Hey everyone! Welcome back to the channel. If you're getting ready for an assistant in nursing AIN job interview, you're in the right place. In today's video, we'll walk you through the most common AIN interview questions and how to answer them confidently. Whether you're new to the healthcare field or looking to land your next role, these tips will help you stand out. So, let's jump right in and get you prepared for success. Question 1. Can you tell us about your background and why you chose to pursue a career as an AIN? You can give answer as, I chose to become an assistant in nursing because it allows me to provide direct care to patients while working alongside a team of healthcare professionals. The role is rewarding, and I enjoy knowing that my work makes a difference in people's lives, especially those in vulnerable situations. Question number 2. What are the most important skills an AIN should have when working with patients? Answer. As an AIN, compassion and communication are key. You need to be able to show empathy to patients and their families while understanding their needs. Attention to detail is also important, especially when monitoring patients or assisting with personal care. 3. How do you handle a difficult or upset patient? Answer. First, I would listen to their concerns and reassure them that I am there to help. It's important to remain calm and composed, especially if they're upset. I would try to resolve the issue within my scope of practice and, if necessary, seek the guidance of a registered nurse or other senior staff. Question 4 was, can you describe a time when you had to deal with a medical emergency or urgent situation? How did you respond? Answer. During one of my work placements, a patient suddenly became unresponsive. I immediately checked for signs of breathing and pulse, then called for assistance. While waiting for medical staff to arrive, I followed the first aid protocol and kept the patient's airway clear. I also reassured other patients in the room. Fortunately, the medical team was able to take over quickly, and the patient received the care they needed. Question 5. How do you ensure the dignity and privacy of patients while providing personal care? Answer. I always make sure to respect patients' privacy by closing doors or curtains when providing personal care. I also ensure that the patient feels comfortable by explaining each step before I begin. Question 6. How do you handle a situation where you're asked to perform a task you haven't been trained for yet? Answer. I would first acknowledge that I haven't been trained for the task and ask for guidance or clarification from a more experienced team member. I believe that asking questions when unsure is important for both my own learning and patient safety. I'd also ensure I understand the procedure fully before attempting any task. Question 7. How do you manage your time and prioritize tasks in a busy healthcare environment? Answer. I believe in staying organized and focusing on the most urgent tasks first. When things get busy, I make a list of priorities, such as patient care, safety checks, or assisting the nursing staff with tasks. Question 8. What steps would you take to ensure infection control and hygiene standards are maintained in your work? Answer. I always follow standard infection control procedures, such as washing my hands regularly, using gloves, and cleaning equipment between patient uses. I also make sure to follow the guidelines for personal protective equipment (PPE) and ensure that the patient's environment is clean and safe. Question 9. How do you work as part of a team with nurses and other healthcare professionals? Answer. I believe communication and collaboration are the foundations of effective teamwork. I always try to stay in regular contact with nurses and other team members to ensure patient care is consistent and that we're all on the same page. Question 10. What motivates you to work in aged care or other patient care environments? Answer. My motivation comes from knowing that I can make a difference in the lives of others, especially those who need support with daily activities. It's not just a job for me, it's a way of making a positive impact on someone's day. Question 11. How do you handle stress or pressure in a healthcare setting? Answer. I manage stress by staying calm and focused on the task at hand. In healthcare, there are often unexpected situations, but I've learned to approach them step by step, prioritizing patient needs and following established protocols. Question 12. Where do you see yourself in the next 3 to 5 years in your career as an AIN? Answer. Over the next few years, I'd love to gain more experience in specialized areas, such as palliative care or dementia care, as I find these fields very rewarding. I also plan to continue my education, perhaps obtaining a certificate in healthcare to expand my skills. Question 16. How do you ensure patient safety? Answer. I always follow protocols, perform regular safety checks, and ensure patients are comfortable and properly positioned to avoid falls or injuries. I also report any hazards immediately to my supervisor. Question 17. What is your experience with using healthcare technology or equipment? Answer. I've worked with basic medical equipment like BP monitors, thermometers, and patient lifts. I'm always keen to learn and adapt to new technology to improve patient care. Question 18. How do you handle conflicts with coworkers or team members? Answer. I believe in open communication. If a conflict arises, I discuss the issue calmly, listen to the other person's point of view, and try to find a compromise to move forward together. Question 19. What would you do if you saw a colleague not following proper hygiene procedures? Answer. I would politely remind them of the correct procedures or report the issue to a supervisor if necessary to ensure patient safety and compliance with infection control standards. Question 20. How do you stay organized during a busy shift? Answer. Staying organized and focused helps me manage my time efficiently. 21. How do you approach end-of-life care for patients? Answer. I approach end-of-life care with compassion and dignity, ensuring the patient is comfortable and their emotional and physical needs are met. Question 22. How do you keep your skills and knowledge updated in the healthcare field? Answer. I attend training sessions, workshops, and read healthcare journals to stay current. I also seek feedback from colleagues and supervisors to continually improve my practice. Question 23. What is your approach to working with elderly patients? Answer. I approach elderly patients with respect and patience, focusing on their needs and preferences. I make sure they feel comfortable, valued, and supported throughout their care. Question 24. How do you handle a situation where a patient refuses care? Answer. I would calmly explain the importance of the care, listen to their concerns, and try to address their fears. If they still refuse, I'd report it to the nurse and respect their decision while ensuring they understand the risks. Question 25. What motivates you to work in a healthcare setting? Answer. My passion for helping others and making a difference in people's lives motivates me. I find satisfaction in providing care that improves patients' well-being and quality of life. Question 27. How do you ensure proper documentation in patient care? Answer. I make sure to record all relevant patient information clearly and accurately in real time, following facility protocols and legal requirements to maintain confidentiality and compliance. Question 28. How do you handle situations where there are language or cultural barriers with a patient? Answer. I use simple language, nonverbal cues, and rely on any available translation resources. I also ensure to be culturally sensitive and respectful of their values and beliefs. Question 29. What would you do if a patient's condition suddenly worsens? Answer. I'd immediately inform the supervising nurse, assist with any necessary emergency procedures, and stay with the patient to provide support until the situation is resolved. Question 30. Why do you want to work with our team facility? Answer. I've researched your facility and am impressed by your commitment to patient care. I'm excited about the opportunity to contribute to a team that values compassionate, high-quality care. Question 31. What would you do if you noticed a mistake in your work? Answer. I'd immediately acknowledge the mistake, correct it if possible, and inform my supervisor so we can address it properly. Learning from mistakes is key to providing better care. Question 32. How do you manage working with patients with dementia or other cognitive impairments? Answer. I use patience, clear communication, and adapt my approach based on the individual needs of the patient. I also involve family members in care when appropriate to ensure continuity and comfort. Question 33. How would you deal with a situation where you're asked to work outside your role or scope of practice? Answer. I would politely explain my role and limitations. If it's something outside my scope, I'd inform my supervisor or refer the matter to someone with the necessary qualifications. Question 34. How do you support patients' emotional well-being? Answer: I listen actively, provide reassurance, and engage with patients in a calm and empathetic manner. I also involve family members and offer support through difficult moments. Question 35. What makes you a good fit for this AIN role? Answer: I'm compassionate, reliable, and well-trained in patient care. I work well under pressure, am quick to learn, and always put patient safety and comfort first. Question 36. How do you ensure effective communication with patients who have limited mobility or speech difficulties? Answer: I use nonverbal communication, like gestures and facial expressions, and I always make sure to speak clearly and slowly. I also ensure the patient feels comfortable and is encouraged to express themselves in whatever way they can. Question 37. What steps would you take if you noticed a patient's medication is missing or incorrect? Answer: I would immediately notify the supervising nurse or pharmacist, document the issue, and follow the facility's protocol for reporting medication discrepancies. Patient safety is my priority. Question 38. How do you handle a situation where you're running behind on your tasks but still need to provide patient care? Answer: I stay focused on the most urgent patient needs, communicate any delays to the team, and prioritize tasks based on the patient's well-being. If necessary, I ask for help from colleagues to ensure everything gets done on time. Question 39. What experience do you have with managing patients who require mobility assistance? Answer: I've assisted patients with mobility aids such as walkers and wheelchairs, and I'm trained in proper lifting techniques to ensure both the patient's and my safety. I always take time to explain what I'm doing to make the patient feel comfortable. Question 40. How do you ensure that a patient feels respected and dignified during personal care routines? Answer: I always maintain the patient's privacy by using curtains or screens, ask for their preferences before starting any task, and ensure I explain each step of the process to make them feel in control and respected. Question 41. What do you think is the most important quality for an AIN to possess? Answer: empathy is key. Being able to understand and respond to the emotional and physical needs of patients makes a huge difference in the quality of care we provide. It helps build trust and ensures patients feel supported. Question 48. How do you handle situations when a patient becomes agitated or aggressive? Answer: I would remain calm and avoid escalating the situation. I'd use clear, reassuring communication and non-threatening body language. If the situation worsens, I'd call for assistance from a senior nurse or security to ensure everyone's safety. Question 49. What steps do you take to build trust with patients and their families? Answer: I build trust by being reliable, empathetic, and consistently communicating with both patients and their families. I ensure they feel heard and respected, and I keep them informed about the patient's care plan and progress. Question 50. How do you manage working with patients who have different levels of cognitive or physical abilities? Answer: I adapt my care based on the patient's specific needs. For those with cognitive impairments, I use simple, clear communication and routines. For those with physical limitations, I ensure their safety by using mobility aids and offering assistance with activities. Question 51. Can you describe a time when you had to learn a new skill or procedure quickly on the job? How did you handle it? Answer: During my placement, I was asked to assist with a new patient care procedure that I hadn't been trained in yet. I asked questions, took notes, and worked alongside a more experienced nurse to ensure I understood the procedure and performed it safely. Question 52. How do you deal with the emotional strain of caring for patients who are terminally ill? Answer: I acknowledge my emotions and try to process them by talking with colleagues or taking a moment to reflect. I focus on providing comfort and dignity to the patient while supporting their family members, which helps me manage the emotional challenges. Question 53. How would you handle a situation where you are asked to perform a task that you feel is beyond your training or capabilities? Answer: I would respectfully inform the person asking that the task is outside my scope of practice. I'd offer to assist in a way that aligns with my role, and if needed, I'd involve a senior team member to ensure the patient receives the correct care. These additional questions focus on real-life scenarios you might encounter in an AIN role, allowing you to demonstrate your problem-solving skills, adaptability, and approach to patient care. Good luck for your future. Please like and subscribe my channel for more informative content. Thanks.